Ladies and gentlemen, it is indeed a privilege and an honor for me in requesting our Honorable Chief Guest, our Honorable Union Minister for Health and Family Welfare, Mr. J P Nadda ji, to kindly give his inaugural address on this occasion. Let's give him a warm round of applause, ladies and gentlemen.
Dr. Poonam Khetrapal, Regional Director, WHO CRO, Shri Bhanu Pratap Sharma, Secretary Health, Government of India, Dr. Soumya Swaminathan, Secretary, Department of Health Research and Director General of ICMR, Government of India, Dr. Jagdish Prasad, DGHS, Government of India, Ministry of Health and Family Welfare, Shri C.K. Mishra ji, Additional Secretary, Ministry of Health and Family Welfare, Shri N.S. Kangji, Additional Secretary, Ministry of Health and Family Welfare, Ms. Dipti, Representative of TB Affected Community, Dr. Luchika, Executive Director, Stop TB Partnership, Shri Anshu Prakash, Joint Secretary Health and Family Welfare, Government of India, Shri Henk Bekadam, WHO Representative to India, Ambassador Jonathan, Mission Director USAID, Dr. Marike, Deputy Executive Director, Shri Dalbir Singh, ex-MP and leader of the Parliamentary Forum, my esteemed colleague, distinguished guests on the dais, dear friends and health leaders who are working in the field of tuberculosis, friends from the media, and all activists who are actively associated with fighting TB. It is indeed a matter of great happiness for me to be here this morning. 24th March is the World TB Day, and we are celebrating the TB program by organizing a program by WHO known as the Unite to End TB, and I'm happy to know that all participants are here to participate in the issue related to fast-tracking access to quality and diagnosis and treatment. This is the issue which we are going to discuss for the whole day. I can assure you one thing, that the deliberations which will take place and the issues which you are going to discuss, the Government of India is going to take it seriously and try to implement as far as possible to the best of its strength and to the best of its commitment. I take the occasion to greet all the health workers, the TB warriors, the healthcare workers, and people who are fighting against TB. It is indeed a very cumbersome task, but not which cannot be achieved. It can be achieved, and we are in the right direction. That is what I would like to say at the very outset. It's the seriousness of the issue can be understood when we see that on the eve of World's TB Day, all stakeholders have come together to find out how to go forward in this direction. The national leaders, the international people, the stakeholders, the private partners, all are here combined together trying to find out the strategy. This itself shows the commitment that we want and we want to see to make this strategy realized in the best possible manner. So I am optimistic, and not only me, I think everybody here in this hall is optimistic that we will be able to end TB. I heard the views which was expressed by my previous speakers. Dr. Luchika rightly said that what is the reason? Maybe that the attention is getting diluted. I think this is a very important issue which needs to be addressed. Because it's a continuous process, and we have been fighting tuberculosis for a long time. RNTCP started in 1997. The RNTCP has also seen many ups and downs, strategizing and re-strategizing. In this course of time, sometimes the attention gets diverted or diluted. So this also needs to be addressed. And I must only show the commitment that as far as Government of India is concerned, we are very closely monitoring and seeing to it that we do not get deviated, diverted or diluted. We have to be focused, and we are working in that direction. Dr. Marike was talking about, when she came in 2008, about yes, we can do it. That was the slogan at that point of time. I think this slogan is very relevant even today. And I associate with her and say that yes, we can do it and we will do it. That is what I would like to say. We will not leave any stone unturned. We will see to it that how we remain focused and how do we go forward. We need both types of strategies, the long-term strategy and the short-term strategy. We want to end by 2030. We know that MDGs have gone and now we are working with the SDGs. We have to be very close to the target and see to it that how do we realize the SDGs. So both strategies have to be developed. It should be long-term strategy as well as short-term strategy. The strategy should be aggressive also. We have to see to it that we go in an aggressive manner. We cannot say that the tuberculosis lives and we also live. We have to say, जैसे कहा अमिताभ जी ने, कि TB हारेगा और देश जीतेगा. तो ये संभव तभी है when we go for a very aggressive strategy. One issue was raised by Ms. Dipti, and it was also reiterated by Dr. Swaminathan, that we need a conducive environment for patient treatment, treating patients. This is also a very important factor. Sometimes we are not able to realize this point, and we treat patients as a commodity. This needs a compassion, it needs a personal touch. And I think in our strategies also we should see to it that this is also incorporated, to see to it that that compassion is there and the environment, conducive environment should be there, so that the treating patient also gets relieved faster. He also gets relief faster. So this is also one aspect which needs to be done. Last year in April 15th, I remember 2015, we were there for call for action to end TB. And after that we have taken a very aggressive campaign. The missed call campaign that has been put in place, it is helping. I have been monitoring personally with Anshu Prakashji and seeing that the missed call campaign should become a very meaningful campaign and see to it that the people who are affected should get the right type of advice, and it is a very successful program. We have also now launched, at this point of time, we have got 121 CBNAT machines. 300 had been procured, 200 extra was to be procured, and today we have launched it. So within the next 2 months, I can assure that India will be having some 621 CBNAT machines working. And this is our commitment. This is going to bring a very meaningful change as far as the diagnostic part is concerned. Practically every district will be having one CBNAT machine. So quick diagnostic system will be in place and we'll be going forward. Today we have launched the new drug bedaquiline. This is also going to make a difference, and we will see to it that with close monitoring and as far as the shortage of introducing bedaquiline, and this is going to make a difference. As far as RNTCP is concerned, Revised National Tuberculosis Control Program is concerned, it's 100% utilization which we are having. It has really brought change. You see, when we talk about India, the disease burden, if it is reduced in India, it has a worldwide impact, because the size and the number and the number of the population, the huge size of the population and the impact it makes is really very meaningful. RNTCP program is also one of the very robust system which has been developed, and it has done very good. It has given very good results. Few issues needed to be re-strategized. They have been re-strategized, and I feel that the the grants given to them have been 100% utilized. That is a good aspect which we have to see. The TB notifications are increasing. Now this itself is a very good sign, because at one point of time, the private players were not coming forward as far as the notification was concerned. DGHS talked about Dipti, that because of private doctors from one doctor to another doctor and not notifying it. That is also one thing which has been greatly responsible for the delay in controlling tuberculosis. So now this notification is on an increase, and I consider it to be a good sign. This means that the private players are also coming forward. They should be encouraged, they should be brought on board, and we should work with synergy with them so that we see that we are able to address this. This will go a long way. I must thank Amitabhji and the media campaign which we have launched, and we'll see to it that this really gives good results. I'm optimistic about the strategies which we have developed, and I feel that it will give results. As I was talking about the RNTCP, it has saved millions of lives, it has averted deaths, the prevalence rate has come down, the mortality rate has come down. We have been, but we should not be satisfied with it. That is what I would like to say. Yes, the results are good, we are on the right track, we are going forward. But that doesn't mean that we should be complacent. We should address, and the real challenge at this point of time, you see, when we talk the numbers, we understand. We have got 4 lakh dot centers. Now if I talk about 4 lakh dot centers, the amount of the infrastructure which is needed for it, the amount of training which is needed for the health workers, and that is all in place. 13,500 we have got what you call that DMCs, and they are operative. So we are trying to see to it that the right type of detection, early detection, all these issues are addressed in the right perspectives. But still the challenge remains. 2 million prevalent rate, 2 lakh TB patients dying. This is the challenge which we have to face. And so I would like to say that we have to concentrate on 3 things. Number 1, to work, to innovate, to adopt new techniques and technology. This is one aspect. When we talk about new techniques and technology, as Dr. Soumya Swaminathan was saying, that at one point of time even bedaquiline will become resistant. So we have to continuously see to it. And it is not only the job of ICMR or the private players, we have to work together and continuously see to it that how the innovation goes so that we are able to address this issue. The second is that to reach the unreached. This is also a very important factor. We are doing surveys, we are trying to see to it that we are able to detect. We are also doing home-to-home survey, we are developing new strategies. But yes, we have to reach the unreached. That is one challenge which has to be addressed. And also to convince the private doctors and the private partners to come on board. If that happens in an aggressive manner, it's going to make a difference. That is what I feel. I'm happy today to introduce the guidelines for the health workers and protocols, and it is going to make a difference, and it's certainly going to give a helping hand to the health workers as well as to the TB patients. That is what I would like to say. Here I find that all the state representatives are here. I'm happy they are here. They have got a very important role to play. It's they who have to closely monitor their states. It is they who have to monitor the districts. It is they who have to see to it that what is the difference, why there is a difference between with one district and the another district in results. Maybe because of the systems are not in place, maybe because the drug supply may be not in time. These are the issues which needs to be addressed. And so state play a very important program. As I said, that to reach the unreached is also one thing which they will have to see to it. At this point of time, I would also like to request the state representatives and also those who are working at the national level. One thing is missing. That is why I was specifically talked about Dalbir Singh, the ex-MP, who is leading the parliamentary forum. You see, in our strategy, we do not take the public representatives on board. So this is a very important instrument which can be utilized. The public representatives is the interface with the public. And these issues needs to be addressed through them also. It's a very talented workforce in the sense that they know how to communicate, their communication skills are good, they are connected, and they can deliver, they can be a very good messenger and help us in this strategy. So, but I find somewhere that part is missing. I'm trying myself. This time in the Parliament session, we are trying to see to it that we have an interaction with all members of Parliament and see to it that on all issues, NCDs, communicable diseases, and other issues are to be interacted with them, brought on board, make them equipped with the systems which we are developing and which we are going forward. So this will be also a very important instrument to really develop public awareness. We are also trying to address the comorbidities as far as the ART centers is concerned, as far as the third line treatment is concerned. You'll be happy to know that HIV/AIDS patients which were getting third line treatment, and the treatment when the CD count was reaching 350, CD count 4 was reaching 350, now CD count 4 at 500, they are being included, and we are trying to see to it that they are also addressed in the right perspective, that they are also addressed rightly. One thing I would like to say in the end, that is the government stands committed. And at the same time, we are not all the repository of all wisdoms. Our commitment is there. We want your involvement. All types of new strategies which you can give. Last year, one of our senior journalists gave an idea of this missed call. It was a very wonderful idea. It was a good idea. We took that idea and we implemented it, and it's giving results today. So what I can say is that the Government of India stands committed. Our Prime Minister has said very clearly, crystal clear, that we have to make health assurable, we have to make it affordable, we have to make it reachable to the vulnerable and the poor sections of the society. And if that is so, we are committed to end TB, tuberculosis. It's a situation where we want to go in an aggressive manner. Your suggestions, your cooperation, your all well-intentioned innovations are most welcome. We will be working on it, and we all together, not alone, with all of you together, we have to work and see to it and really resolve on the World TB Day that we will fight, we shall win, TB will lose. Thank you very much.
Thank you very much indeed. Honorable Chief Guest, Honorable Union Minister for Health and Family Welfare.